Hey guys, and welcome to How to Gastro. In today's video, we'll be talking about proctitis. So let's get started. So what is proctitis? Proctitis is the inflammation of the anus and the lining of the rectal canal. It affects only the last 6 inches of the rectum and is most commonly caused by sexually transmitted diseases. So if we look at my image on the right, we see the rectum and we have the anus down here. But basically, proctitis is the inflammation of the anorectal canal, which means this area down here. So from the definition, we get that it usually just involves the last 6 inches of the rectum, which is this bit, and is most usually caused by sexually transmitted diseases. So what are the signs and symptoms of proctitis? A frequent or continuous feeling that one needs to have a bowel movement, rectal bleeding, which means hematochezia. If there is severe bleeding, anemia can result. The passing of mucus through the rectum, rectal pain, pain on the left side of the abdomen, a feeling of fullness in the rectum, diarrhea, and having pain with bowel movements. So now let's get into more details about the sexually transmitted proctitis. All sexually transmitted cases of proctitis usually occur after anorectal intercourse has taken place. The most common cause of sexually induced proctitis is with Neisseria gonorrhoeae, which causes the disease gonorrhea or gonococcal proctitis. Symptoms usually arise 5 to 10 days after exposure and can include pruritus ani, which is itchiness around the anus, constipation, a mucopurulent anal discharge, which means a discharge of pus and mucus, and this can be with or without bleeding, and sometimes pain and tenesmus. Another form of sexually transmitted proctitis is by chlamydia trachomatis, and this is usually caused by the serovars D to K, and an infection with chlamydia trachomatis means we have a chlamydia infection, and this generally causes a mild proctitis. 2/3 of infections are known to be asymptomatic, and when symptoms are present, they are usually mild and include pruritus ani, a mucoid discharge, and perianal pain. So moving on, we could also have lymphogranuloma venereum, which is a systemic disease that is also caused by chlamydia trachomatis, but this time we have the serovars L1, L2, and L3. And this infection tends to be a lot more invasive than the D to K serovars. So remember, in the slide before, we said the D to K serovars are usually asymptomatic in about 2/3 of patients, but when they do cause symptoms, it's very mild. But serovars L1 to L3 of this bacteria, chlamydia trachomatis, causes a more severe form of proctitis. The clinical course of LGV, which is the lymphogranuloma venereum, can be divided into 3 stages. The primary lesion occurs at the site of inoculation, usually 3 to 30 days after sexual contact, in the form of a painless pustule, shallow ulcer, or erosion, and is often unnoticed by the infected individual. A secondary stage can occur 3 to 6 months after exposure and manifests as an inguinal syndrome or as an anogenital-rectal syndrome. Both syndromes may be associated with systemic features including fever, arthralgia, myalgia, malaise, or anorexia. So this can go on to cause fever, arthralgia, which is the inflammation of the joints, myalgia, which is muscle pain and weakness, malaise is general weakness, and anorexia, which means a decreased appetite or not taking in enough food. In heterosexuals, the most common manifestation is a tender inguinal or femoral lymphadenopathy that might go on to suppurate and ulcerate. So these patients usually have palpable lymph nodes in their inguinal area, and these can suppurate, meaning it can become pussy, and can ulcerate, which means it can form a sort of like an erosion. Progression to this tertiary stage may occur if the infection remains untreated, causing chronic inflammatory response and tissue destruction, and this may be associated with a stricture or fistula formation, again mimicking Crohn's disease. So this disease in its more advanced stages can be hard to distinguish from a Crohn's disease patient. So the clinical workup has to be a good one in order for us to diagnose this LGV. Moving on, another sexually transmitted kind of proctitis is the herpes simplex virus infection, and this may also be acquired through anal-rectal intercourse. Most infections are from the HSV type 2 and typically presents with small vesicular lesions which go on to ulcerate and then resolve over a few days. This infection predominantly affects the perianal skin and anal canal, but may also extend into the rectum. Another form of this proctitis is caused by the bacteria Treponema pallidum, and this causes cases of infectious syphilis, which have risen sharply in the last few years, and the disease has 3 primary stages. The first stage, or the primary stage, is one painless sore, less than an inch across, with raised borders found at the site of sexual contact, and during acute stages of infection, the lymph nodes in the groin become diseased, firm, and rubbery. So we see this in stage 1. We have this painless sore with its raised borders. You can see these raised borders, and it's found at the site of sexual contact. The second stage, or the secondary stage, is a contagious diffuse rash that may appear over the entire body, particularly on the hands and the feet. So if we look at stage 2, this usually occurs 4 to 10 weeks after the initial infection, and we have this rash which is diffuse on the whole body. The third stage, or the final stage, occurs in the late course of syphilis and mostly affects the heart and nervous system. And this is where we have neurosyphilis, and this can occur 3 to 15 years after the initial infection. So not all causes of proctitis are due to sexually transmitted diseases. We may have some other causes for the disease too. Proctitis has many possible causes. It may occur idiopathically as idiopathic proctitis. It may also occur post-radiation therapy as damage by irradiation, for example, in patients who are having radiation therapy for cervical cancer. Because the radiation is so close, aimed at the cervix, which is very close to the rectal and anal canal, the patient can develop the secondary form of proctitis due to irradiation. If the physician suspects that the patient suffers from Crohn's disease or ulcerative colitis, a colonoscopy or barium enema x-rays are used to examine areas of the intestine, as these diseases may also cause proctitis. So if we look at ulcerative colitis, you can see it has a form of proctitis, meaning that this is the area of the focus of the disease, and this area has the inflammation and ulceration mostly in this area. And this is a form of proctitis due to ulcerative colitis. And it may also be caused just by anal intercourse, not by an STD with anal intercourse, but just by anal intercourse. We can have inflammation of the lining of this anal-rectal region post-intercourse. So now let's talk about the diagnosis of the disease. Patients presenting with rectal symptoms should have a physical examination, including an abdominal examination, anogenital inspection, and examination for inguinal lymphadenopathy. A stool sample should be sent for microscopy and culture in patients with altered bowel habits or abdominal symptoms. Proctoscopy can be used as a bedside tool to examine the anorectal mucosa and to inspect for any ulceration, inflammation, discharge, or bleeding. So this is an example of proctoscopy. So basically the proctoscope is inserted into this anorectal region and the doctor looks at it on the screen, and we're able to notice any signs of inflammation, erosion, ulceration, bleeding, discharge, etc. Rectal swabbing for gonorrhea and chlamydia can be taken blindly or at the time of proctoscopy. We can also do PCR or polymerase chain reaction, and this is very valuable and highly sensitive, although culture remains the gold standard. So rectal swabbing and culturing is the gold standard, but PCR is a much faster and highly sensitive way. Gram staining and glass slide microscopy can also provide an immediate diagnosis of gonorrhea. Chlamydia PCR is now the standard diagnostic test for rectal chlamydia. Treponema pallidum cannot be cultured, and this is the bacteria that causes syphilis or syphilic proctitis. And we usually need dark ground or dark field microscopy of exudates from rectal ulcers for the diagnosis. And if we look at this little image at the bottom here, we see those little Treponema bacteria on the dark field microscopy. Demonstration of antibodies in the serum is the mainstay for syphilis diagnosis, so we can also test the blood for antibodies, and we can do serological tests for specific antigens or antibodies to test for the different STDs in the blood. The treatment of the disease. Treatment for proctitis varies depending on the severity and the cause. For example, the physician may prescribe antibiotics for proctitis caused by bacterial infection, but if the proctitis is caused by Crohn's disease or ulcerative colitis, the physician may prescribe a drug called 5-aminosalicylic acid, which is known as 5-SA, or corticosteroids applied directly into the area in enema or suppository form, or taken orally in pill form. Patients with chlamydia and gonorrhea can be treated with azithromycin 1 gram as single dose or doxycycline 100 milligrams twice daily for a week. Patients with LGV can be treated with doxycycline 100 milligrams twice daily for 3 weeks, or erythromycin can be used as an alternative. Gonorrhea is usually treated by cefixime, a third-generation oral cephalosporin 400 milligrams as a single dose, ceftriaxone 250 milligrams intramuscular, or spectinomycin 2 grams intramuscular for patients allergic to penicillin. Treatment for primary herpes simplex virus proctitis is with oral acyclovir, and patients with early syphilis are treated with intramuscular procaine penicillin 10 days or benzathine penicillin 2.4 grams as a single dose. And that brings us to the end of this video on proctitis. Thank you guys so much for watching. I hope you find these videos very informative and useful. Please make sure to like, comment, subscribe, and share. And if you'd like to download a copy of this presentation, you can do so by clicking the link in the description. Take care and bye for now.